The Northern Territory PHN commissioned Indigenous-specific services for mental health and alcohol and other drugs in the Northern Territory. We used an existing partnership forum which is called the Northern Territory Aboriginal Health Forum, which is the key Aboriginal health planning forum for the Northern Territory, to co-design what the solution would be. We were very conscious that the solution needed to be culturally appropriate, that it needed to really service the individual communities in a way that was relevant to them. It needed to be delivered within our existing funding and framework, so there were certain parameters to how that could be delivered. And we also wanted to ensure that there was appropriate quality and safety measures and that it was evidence-based in what we were delivering. Through the co-design work, we determined that the most appropriate model for the delivery of the mental health and alcohol and other drug funding for Aboriginal people was through a social emotional wellbeing model. The model recognises elements of self-determination, of cultural supports, the centrality of family, kinship and culture, and really builds on the strengths of the Aboriginal population. The model is also underpinned by trauma-informed care principles, which was considered to be a really vital element of the model to be commissioned. The social emotional wellbeing workforce being made up of 3 streams of care, a medical stream, a therapeutic stream and a social and cultural stream. We mapped the social emotional wellbeing services across all 84 clinics of the Northern Territory to determine where there were gaps in the current service level in relation to population level data. And that really determined our approach to meeting those gaps through a direct procurement process. Following the process of service mapping and identifying where there were gaps, we undertook a priority setting process to identify where we would specifically commission services. Through that process, we also undertook a collaborative finance and budget process to make sure that we financed a model that was actually possible to deliver. In rural and remote areas, we sometimes have issues with housing to house workers, and there's also significant workforce shortages. So we wanted to ensure that there was enough incentive for those positions to ensure that we could recruit to them and that they were well supported. A really important aspect that we did learn was around the importance of skilled facilitation. So for PHN staff, the skills and capabilities that we needed within the team were really around ensuring that we could facilitate different points of view and a range of cultural, social, environmental contexts. If we didn't have the right people at the table, it wouldn't work. So it was really important to ensure that we did have the right mix of people. And the process of engaging the stakeholders and the right stakeholders meant that there was a really good level of buy-in and engagement. We started with a different idea and through the process of co-design ended up with a different model and a different solution and a different approach. And our ability to listen, engage and be flexible and responsive really built some trust for us in the sector. So it was a great outcome. A clear learning for us through the process was to ensure that we're really engaging on a local level. Each region across the Northern Territory has a different context, different services, different level of access to services, different ways that they would like to engage with the community, different workforce that works for them. So whilst we undertook a systematic planning process for the model, it was really important that we localised that to context. That did make it difficult in having a standard approach upon which we can base monitoring and evaluation and look at the program across the board. But there was no point in dictating a model that was not going to work on a local level. We have established a social emotional wellbeing working group that can look at what the wraparound supports for that workforce are in terms of cultural and professional supervision, opportunities for that workforce to come together and share their learnings and look at opportunities for future planning for that workforce as well.